Mr. Poliquin, you recognize.
Thank you, Mr. Chairman, very much. I'd like to salute Ms. Brownlee for her forthcoming support for this bill, and I want to join her in this bipartisan fashion. This is a great piece of legislation, Mr. Chairman. I salute you and folks on the other side of the aisle that work so hard to get this done. I represent the rural part of Maine. Now, some people think that all of Maine is rural. Now, that's not true. But the 2nd District is highly, highly rural. And we have one medical facility, one VA hospital in Maine, Togus, we're very proud of. But, you know, there are a lot of folks, Mr. Chairman, that live 3, 4, 5 hours away from Togus. And when it's 2 in the morning and the snow's blowing sideways, you're not feeling well, it's really much better, much more convenient, and just common sense to be able to get your health care close to home. And I know that 38 of the veteran service organizations also support this compromise legislation. This is the House, the Senate, Republicans, Democrats. It's exactly what we should be doing here. One more thing I want to mention to everybody, and some of the other folks on the committee may have already seen this. If not, they may come into this. One of the problems we've had with the choice program that this bill helps fix is that our small local hospitals that are providing veteran services to our folks that live in their local areas are not getting paid, sometimes for 1 or 2 years. And so I've become a bill collector, Mr. Chairman, for our small rural hospitals in Maine, including paying a house call, unannounced house call to the folks over at HealthNet to make sure we made the point that it is critical that our small local hospitals get paid, not only for our veterans, but also it keeps our small rural hospitals open. So it helps everybody else in the community. So I'll be supporting this along with Ms. Brownlee, and I appreciate that very much. And I do hope we have a big bipartisan vote. And another thing I want to mention, Mr. Chairman, I know it's been said before, maybe not in this hearing, but it's critical to say, the choice program is not designed to replace the VA. That is not the goal. We have 66,000 veterans that we just adore in our 2nd District of Maine, and they heal better when they're with other veterans. We understand that. But sometimes it's just not practical for our veterans, as I said a moment ago, because they live so far away from a veterans facility. It's better to get their health care close at home. So this augments, this supplements the VA. It doesn't replace it. So I'm all in. I appreciate it very much. We've got to make sure our small rural hospitals get paid so they can stay open for our veterans and everybody else. And this is one of the things that this piece of legislation does, and I salute you for it, sir. Thank you.
Thank you, gentlemen. There are at least 2 square miles of Maine that are not rural. I would agree with that.
They're both in my backyard, sir. Thank you.
Having been in Maine and drove for 2 hours one night and didn't see a car.
And you loved every minute of it, Mr. Chairman, every single minute of it.
Herniated disc. Mr. Higgins, you're recognized.